And how we're dealing with it is that the health services, and this isn't just UK, it's all world over, France included. Health services have in fact been kind of shut down. They've been scaled back to a skeleton service. Usual clinical procedures have now been cancelled or shut down, and we are dealing with emergency only, life and death only, and COVID related illness only. This will again inevitably lead to lost lives. So are we paying with lives to save other lives? Now obviously the NHS cannot save everybody all the time. That's just silly. However, the government at the moment has opened endless credit lines. It is borrowing us out of existence in order to pay half the nation to stay home. They are spending money to whack up pop-up hospitals, which apparently are redundant due to either a lack of patients or a lack of staff. And they can order the NHS to run an emergency-only skeleton service. I would ask, could this not have been done, the pop-up hospitals and the scaling back of normal services, could this have not been done? Could they not have borrowed just endless money to actually deal with the problem while not having to lock us all in our homes? We have had to sacrifice everything, our livelihoods, our human rights, and in a lot of cases our lives, to save the NHS. Should we not be asking the government to give the NHS what it needs to save us? We are at the moment plundering our coffers, and we are building up generations and generations of debt. That is generations and generations of poverty, austerity, which will result in more death. Now, if the NHS even ever gets back to a normal service, how is it going to cope with these mounting social problems and the clinical backlog? The staff are at the moment subject to the same trauma-based mind control as everybody else. They're going into the workplace thinking that they are going to contract a deadly illness and die, and if they don't do that, they are going to carry the illness home and infect their family. They're not supported properly with the PPE. They are tested and told that they are infected. They are not told, they are not reassured in how to deal with this deadly illness. And are they ever reminded that normal healthy people should not be dying of this illness? No, they are just terrorised. So they have all of my love and support, of course, and I'm sure they have yours as well. However, the NHS as a system is not giving good health advice. It's actually giving the opposite of good health advice. If you are advising people not to get as much fresh air and sunshine as you can during a flu season, then you are not giving good advice. Never mind vitamins and minerals and clean water and other things that are basic to the good functioning of a human body. They are now demanding that already ill and vulnerable and elderly people stay isolated for a further 3 months, being denied fresh air, sunshine and human contact. Now, this is going to in fact accelerate these people's deaths, if you ask me. It's really quite dangerous advice, in fact. Now, I'm afraid that the NHS, as precious as it is to everybody, is utterly corrupted at the highest levels. It is completely captured by the pharmaceutical industry, which means that your money is funneled to huge financial interests. The corruption is astounding if you ever care to look into it, and this is why we are being offered a vaccine as the only solution out of this predicament. Not herd immunity, not a raising of the general health standards, just a vaccine, which I'm afraid is not a treatment for a disease. It's never cured any disease, and I'm afraid it's just business as usual. I would also say to you that your government and their corporate masters have been dismantling your health service for years via the back door. And this catastrophic plan to deal with an epidemic will result in the gutting and selling off of your NHS with plausible deniability, which means they can do it now out in the open and blame the terrible disaster of the COVID disease, and you will, anyway, lose your NHS. So we're not really saving lives, okay? I think we're actually sacrificing them, and I don't think we're saving the NHS either. I think it's highly unlikely that we're saving it at all. So why are we staying at home? Are you beginning to see how backward and utterly bonkers this all is? I would even say it is completely evil. Let me know what you think, and you can do that privately, because I'm coming to understand that airing our views is becoming kind of dangerous in one way or another. It's either social suicide or being completely censored. So, why are we going along with this? I would love to know. Is it too late? And has the damage been done? I don't know. But we really need to make sure that this doesn't happen to us again. And we have to reject the measures that are being put into place right now to deny us of our human rights forever. Because then it really will be too late. The reason they work so hard to control your mind is because they can't actually do this to us without our consent, without us going along with it. And at the moment they're working to put various technologies in place. Yeah, it's not any kind of secret, to make sure that we will not be able to reject the measures or withdraw our consent. So whether you agree with me or disagree with me, we need to think about this and we need to talk about it. Maybe you don't want to talk about it, maybe you don't want to think about it because you're sick of the whole thing. But I'd say that is just playing into their hands. Because you're going to get so sick and tired of this, you will actually consent to anything to get back to normality. Anyway, as I say, please get in touch with me, and we should all start trying to figure out what the dickens is actually going on. Maybe that's should be the theme of my next video. Anyway, that's enough for today. Stay sane out there, and I'll speak to you soon. Bye.